Order. This time I'd entertain a motion to adopt the agenda.
So moved.
First by Kalen, second by Stephen. All those in favor? And that passes 6-0. Please note that Mr. Snelling is absent this evening. All right. Moving on to discussion action items. First up is approval of the 2021 COVID leave resolution. Dr. Tomlinson.
If it pleases the board, I'd like to present a resolution that would be in effect for this school year, and it would cover up to 10 days of paid leave for any staff members that provide proof of a positive COVID test. And that wouldn't have to be used all at one time. If they needed 5 this time, they had 5 for another time, or if they had to use all 10, however that works. But it would be capped at 10 total days for the school year. I think it's a good benefit for working with our staff if they happen to be unfortunate enough to have a positive test, and maybe help them get through that type of an incident. So I would ask for your consideration. I do have all the information on what I'd ask the resolution to be, and it does give some opportunities to make some changes along the way depending on how the year plays out.
Now, did we get money in from the CARES Act, or I know we discussed this before?
It wouldn't be relative to this.
Okay.
There are ESSER monies that will come in that we are getting reimbursed for certain expenses, but this would be something that would just be an expense that the district would take on.
And substitute employees are not qualifying for that leave.
That's correct. And part-time employees would get prorated benefits for the amount of time they would typically work in a day.
All right.
So moved. First
Second.
by Darren, second by Kalen. Anyone have any further questions, comments? Hearing none, all those in favor? And that passes 6-0. All right, before we move on to item number 2, I'm going to just read a quick statement. Per board policy BDDH, the board reserves the right to impose reasonable restrictions. There will be no speakers tonight, as we allowed speakers on this topic at the previous board meeting. Additionally, we have reviewed emails and phone calls and surveyed the constituents. We feel like we have a good understanding of both positions, and we are here tonight to make a decision on whether to make masks mandatory or to recommend them. So that's why there's no visitors forum this evening. All right? So we'll move on now to approval of an updated return to school plan by Dr. Hucks.
I'm going to hand it over to Dr. Tomlinson to go through this presentation.
So I know that the board members all received this, but it was just kind of an update, a snapshot on where we are today, some of the things that are going on, and maybe some relevant information that you might want to take into consideration as you review this issue tonight. So the first was where we're at with Clay County health guidelines. So there's some information here as far as what the recommendations are from Clay County Health as well as the CDC, what social distancing looks like. It's a little different in schools than it is out in the public, so it's a 3-foot social distance requirement for students, and there is a recommendation for continued testing, ventilation. The biggest thing I always try to tell people is that there's more things than just masks, right? Risk mitigation involves everything. So it's about how we cohort students together. It's about how we handle an isolation of an individual if they do have symptoms or if they do test positive. How do we contact trace? Like, there's a litany of things that go into it. And so it's important to kind of realize that it's never just one thing, right? So there is a list there of some of the Clay County health guidelines. At this time, Clay County is not mandating masks. They are recommending masks. And that's what their emphasis has been, and we've actually followed up with them to say, hey, is this exactly what you're saying? Is this what you mean by this? Are we interpreting this correctly? And their director has assured us that, yes, that's exactly what we're saying. So we felt like that was, at least we were on the same page with them. As far as location and our proximity to people around us, currently all the other districts in Clay County currently have some kind of a mask mandate in place. It's really organized as you look towards the city and get closer to the city, there's more mandates. As you turn around and look the other direction, if you look to Oric and Richmond and out in that direction, there's almost none. So we're kind of in that middle ground of, are we going this way or this way? Hence why it's probably a difficult decision for you. Also in our conference, so we do participate in an MRVC conference. And you can see a list there of what the other schools are doing for mandates. Most of those do not. So most of the places that we will visit for athletic events do not have them in place. When they come here, obviously, they'll be curious what our decision is here tonight. Obviously, there's a number of metro schools, but for the most part, closer to the city you do, further out you don't. The next is an infographic we put together. Actually wanted to send this out about a week ago, but once this came up as a board issue, wanted to save this and bring it to tonight's meeting because I think this kind of gives a good idea of what a kind of a contact tracing flow chart. So when would you have to quarantine? What would keep you from having to quarantine? And this kind of gives you hopefully some easy read of figuring out, hey, if this is the situation, no quarantine. If this is the situation, quarantine. And it's not the easiest of information because there's multiple options within each. And I tried to line those out in the bottom, but it gives you a good sense for what it takes to be able to stay in school. Obviously, if you're able to be vaccinated, if you're vaccinated, you do not have to quarantine, period. So that's kind of the catch-all. If both parties are wearing masks with a social distance, then neither of those do. If either person isn't masked, then both might have to. So it kind of varies that way, but I thought this would be a good infographic to be able to send out both to all of our staff and all of our parents. It might be a good understanding for, what do I have to look forward to with what quarantine could look like. One of the questions we've had, so I know at our last board meeting, we talked about the number of vaccinated individuals in 64024, and I had a number of people email or call and say, those numbers aren't right. I called the county and they said this. I double checked. I actually called and spoke, verified with them. They've actually gone up since our last meeting because more people have received them. The numbers were accurate. It's important to understand the context of it. In 64024, age 16 and up, because that's all they had data for, those numbers were accurate. If you take a look at the county as a whole, the numbers, they varied and were different, so sometimes people get confused on what the numbers mean. But in 64024, 16 and up, those were the numbers. We did verify those. You can take a look on this next slide. Talks a little bit about where we've been over the last year, a little over a year. And you can kind of see the rise in the transmission rates and how they've fluctuated. And you can kind of see where we're at right now. We've been on a spike here throughout July. And currently it looks like there's a little bit of a downtick just recently. So there's been a pretty big uptick over the last month and a half. And then just recently there's been a slight downtick. Again, we talked about mitigation strategies. Where we're currently at in the district, as we were at our last board meeting, is we said that masks were highly recommended. And we listed the other 19 mitigation strategies that we wanted to take on to make sure that we provided as safe of a learning environment as possible for both our kids and for our staff. Dr. Hucks had a request to try to see what could we find out from our staff and our community on a survey. So we put together a survey and tried to find out a couple different things. We wanted to see what were people's opinions on where they could find information, if they understood where we were trying to communicate with them, what their technology access would be if they had to learn remotely through virtual school, how they felt about PPE, returning to in-class education, having to be virtual, wearing masks, not wearing masks. Mask was one thing on there. There's a lot on there. But I think masks were kind of driving the survey, to be honest. I think that's probably the hot topic, as I'm sure we all know. But if you take a look at some of the information here, if you look at the distribution of the results, we had over 2,000 responses on our survey in just over 2 days. I can tell you in the 8 years that I've been here, that's the most responses we've had on any survey we've ever done in that time frame. Obviously the high school, you'd expect the high school to have the highest number of responses as it did, and then the middle school, it really went perfectly with kind of the distribution of students and staff within the buildings. So that's what you would expect to see. We talked about, are you familiar with where to find updated information? 36% said familiar, 30% very familiar. So you're looking at over 2/3 of people felt really good about where to get information, so I think that's positive. Somewhat familiar was 25%, and only 10% said no clue. So we'll have to figure out how to target those 10 people a little bit better, but overall 90% of people had some idea. On the next slide here, it says, what factors would help you feel more prepared for back to school? So cleaning and sanitizing was number one. And then the second one, you couldn't see it when I copied off the application, but the second one there was temperature and health screenings at the schools. So that was a little over half the people said that. Almost 3/4 of them said cleaning and sanitizing. Then social distancing, then provide PPE, then virtual learning opportunities, then hybrid schedule, and then mask recommended, not required. That's the order right there on that slide. And then on the next one, it says, what's your greatest level of concern when returning to school in the fall? Number one was, I feel comfortable that the school district will mitigate risks. So I actually like that. That was the largest response, was that we trust that you guys will do the best you can. The second one was masks. So that was 36.6% was masks. The third was learning from home, and then social distancing, then having enough sick days for employees, which hopefully we just kind of helped out with that tonight. Cleaning supplies, having in-person, readjusting to school, and then masks recommended. So that was kind of the order of that question. Then the big question, I thought I might as well just hit this one right in the head, right, and ask, should masks be required for? Only recommended, not required. That was 66% of our total surveys. Staff required was 30%. Elementary students, 30%. Secondary, 28%. Outdoor athletic events, only 6% thought the mask should be required there. So it was pretty cut and dry. It was either you think it should be recommended, not required, or if it is, whether it was staff, elementary or secondary, is right out of that 30% mark. Said when you participate in virtual school, your internet access is, and we took a look at this. So we had about 40% said they have pretty good internet and it's pretty good for virtual instruction. We had another 34% say it's good and perform very well with instruction. And we only had about 15% that said they don't have internet or it does not work for them at all. So that's something I think that we've tried to approach last year. We got some different hot spots. We had mobile internet available and Wi-Fi on buses. We opened it up at a lot of our buildings where people could come up use our Wi-Fi in our parking lots and try to get as much access as we could. But obviously there's still probably a gap there that we need to evaluate and see how do we get internet to people that might need it if they are virtual. Because who knows how this year is going to play out.
So this last slide here, I asked these to be put in here because 2 weeks ago when we did meet with the board, few, if any, school districts had made a decision on masks, and so that's why one of the things that has changed since then, as Jarrett mentioned earlier, we're one of the only school districts in Clay. We are the only school district in Clay County without a mask mandate. So, but we also noted at that August 9th meeting that our plan is flexible, and we do have the opportunity to change it. Okay, and so during these last 2 weeks, as you would expect, we've monitored the situation, as a pretty vague generic phrase, but that's surveying the public, reviewing emails, phone calls, interacting with health department officials, having meetings. I mean, just every day, something on this topic. So, and so because of things like stakeholder input, changes within area schools, health department input, we decided it was best to have a special meeting before school started so we could determine a position on masks. If you remember August 9th, it was like, hey, we're going to go this direction. There's no mandate in the county, so we're just going to go this direction. But since then, stances have been taken, and there's a lot of opinions out there about what should be done, and so that's why we decided we should have this meeting and form a position and move forward on that position. So, with that being said, based on polling, members of the board, these three options have come up as potential options to consider for tonight's meeting. So that's why you see the three options there. The first one is continuing with what we're at, which is highly recommended. The second one is to mandate universal indoor masking, and I put in parentheses CDC recommendation because it is indoors only, and basically what that means is everybody wears a mask while indoors. Doesn't matter if you're vaccinated, any of those things, right? It's just that. And then kind of a blended approach to option 1 and 2, as Jarrett mentioned earlier, mitigation strategies. There's multiple mitigation strategies. So masking alone doesn't work. Masking with social distancing, ventilation, cleaning, it's, to use that Swiss cheese metaphor, So we noted this option too, which is masking, mandate masking indoor when social distancing cannot occur. And so basically what that would mean is everyone would wear a mask when they're not social distancing. And give you an example, for kids, that's 3 feet. You remember last year it was 6 feet. This year it's 3 feet. And within the 15 minutes is a factor that would determine quarantine. 6 feet still applies to the adult, but the adult can be vaccinated. So for what it's worth, that's some information on those three. Now, this point number 4, because the CDC notes this in their recommendations, can consider medical exemptions, okay? And that's not, consider medical and developmental exemptions, I should say. But basically, you would require a doctor's note. And I wasn't here last year, but Dr. Tomlinson assured me that last year we also had this same facet when masks were in place last year, that medical exemptions were reviewed and determinations were made by administration based on a doctor's note, for example. So I don't think you have to add that in to any of these if you do go with options 2 or 3, but because I think the administration can still continue to perform that function. So with that being said, this is where we're at. We need to pick a direction and go with it.
So,
Questions, comments?
no, you just need a motion then for one?
A motion, potential motion, I'll read the 3 potential motions that you can do. Number 1 is I move that the Board of Education continue the practice of highly recommending masks. Option 2, I move that the Board of Education update the return to school plan to include mandated universal indoor masking. Potential motion number 3, I move that the Board of Education update the return to school plan to include mandated indoor masking when social distancing cannot occur.
I move that the Board of Education update the return to school plan to include mandated universal indoor masking.
I will second that.
All right, we have a first by Kalen, we have a second.
I do have one question.
Hang on a second. Hang on a second. Darren's our second. Okay, now questions or comments?
Question. If we went to mandated indoor masking when social distancing cannot occur, would that cover us as far as keeping our kids in school?
Maybe, maybe not.
Why not?
I mean, it's just, here's the
Because I think the
thing.
bottom line is we want our kids to stay in school.
Well, I agree. And I look at it as, part of our responsibility and our biggest responsibilities are A, to educate the children
Yep.
to the best of our ability. But we can't do it if they're home. I mean, I'm sorry. Virtual learning works, but it's not optimal. Okay, I mean,
Also,
it's just-
their health and
It's
safety.
just not optimal.
Yeah.
But it's also to provide them with a safe environment to learn in. So is mask 100% perfect? No. Is the vaccine 100% perfect? No. Is social distancing 100% perfect? No. So it kind of goes to that Swiss cheese theory of the more layers you can lay in between, the better our odds are that we keep kids in school where they need to be learning.
Right.
That's kind of my thought process and how I've thought about this for 3 weeks.
So back to
So-
Dr. Tomlinson's, if everybody's wearing their mask, the whole quarantine thing, there's no more. If you're properly wearing your mask, the kids can stay in school.
If one gets infected, if one's infected.
If
So-
one's
so
infected
if there's
and
a
everyone
child-
wears masks, everybody can stay in school.
Can you scroll back to that?
And just monitor your health.
Yeah.
If they're not vaccinated, even if they are wearing a mask.
Correct.
Keep going back.
I mean, I just feel like our job is to educate kids, keep them safe, and make sure that they're learning, in school, not from home.
Which we
So-
learned from last year of how it can go south
There
very
you go.
quickly.
And coming from a
And
virtual
coming
parent.
from virtual, we're much better trying to keep them in school.
So if both are masked, the COVID positive person quarantines, but the rest of the people, no quarantine. and
Right.
self-monitor.
Stay in school.
Does that make sense? Does that make sense, Kenny?
If they're masked.
If they're masked. If no one's masked, then everybody gets quarantined.
Right.
Well, if one of the people are not masked, they all quarantine.
Yes, that's, yeah.
Yes.
So if one of the kids aren't masked and my child is next to someone who's unmasked, then she or he will have to quarantine.
Yes.
Right,
That's how I interpret
Yeah.
it.
right.
So.
Gary Zabarak confirmed that for us.
And again, this is on review
Every 30 days.
Every 30 days.
So next month will be,
So we will come back and reapproach it in 30 days.
Which again, that continues us to be flexible,
So.
which that doesn't change.
And if you look at what's happened on, I look at Florida and Texas, but they've got such a higher rate of infectious anyway than we do. So I mean, I don't want to say they're an anomaly, but for us, they're not really a good comparison. But I look at what happened over in KCK with Turner and Kansas City School District. They were in for a week and they have hundreds of people in quarantine already in a week's time. So it's like, well, and they went no mask to start with, and now they've all flipped to mandatory mask, and because of that. So, I mean, it's going to happen. The problem is, don't get me wrong, because after we vote, I'm going to implore you who came to us for mask, if that's how it goes, to go after the city and to go after the county, because it don't matter what we require in school. When they go home, they don't wear masks.
Right.
If they go to,
Walmart,
if they
they're
go
not
to
wearing masks.
Walmart or restaurants. So, I mean, they can still bring it in to the school, don't get me wrong. So, you can still have outbreaks. So, I mean, fixing one piece of the community doesn't protect us all, so.
meetings.
All right, so any further comments or questions?
So you just need votes?
So, the motion is that the Board of Education update the return of school plan to include mandated universal indoor masking.
Yes.
Well, real quick, Nick,
Okay.
the doctor note thing, that's for, it's already, no matter what.
Yeah, no matter what
If
we
we include
do.
that or not, you can,
And there's limited medical reasons that they can get a waiver.
That'll be an
I
administrative
can tell you how it worked
procedure.
last year.
Yes, please do, Jared.
So we take a look at those requests that come in. I can tell you just because they have a note does not mean they get a waiver. So it is totally at the discretion of the district nurse and the administration. There are certain cases that wouldn't, you can get a doctor's note, but it may not necessarily meet the requirement for what we think is reasonable.
And the county has guidelines on
The
what
CDC
are-
does too, actually.
Yeah, what
So-
are medical,
Children's Mercy actually has a
that's,
flow
I think
chart.
that's
you
the one
can
I
use.
saw.
So-
Children's Mercy.
You take a look at each individual case and try to make the best case, hey, if this is something that's truly a legit thing, 100% we're gonna take care of that, like we always do that. If it's one of those things where, I don't really think so, then we may not.
So this mandate will include anyone that comes into a school facility indoors.
indoors.
Universal and
Indoor facility, correct.
And so going.
Students,
students.
Anyone.
that's what I mean. I'm just making sure everybody
The
understands the
Pepsi delivery
clarification.
guy.
It's
Everyone.
everybody that walks
Okay.
in the building.
Everyone.
So then when kids go out for recess, they're
In-
not having to wear their mask out of recess.
Well, that's a good question, because if we say they don't, and they're close to each other, they would now have to quarantine. That'd be a close contact now.
Right, well, I mean, this is saying indoor, I'm just.
Yeah,
But that-
the CDC recommendation for universal indoor is universal indoor masking. So, we have the other mitigation strategies we can put in place, like cohorting. But he is right, I mean, the kids are
Not
gonna play
just
together, but
masking.
whether they're, 15 minutes, et cetera, but it does,
Well, how long is a recess?
Probably 20
At
minutes.
elementary.
isn't it?
20
No
minutes.
clue.
Do we
Yeah,
have
I
any
don't
teachers
either.
here?
I'm gonna guess 20 to 25 minutes.
Oh, yep.
Can you speak up? I can't hear.
Can she
Oh,
answer how
sorry.
long recess is?
Yeah,
Yeah,
About 15 minutes.
about 15
15
minutes,
minutes.
so we'd be right at the
Right at the mark.
limit anyway.
And you know, when we've been working with the health department folks, this isn't like a stopwatch situation, where we go back and add up, they were 43 seconds here, 14 minutes and 10 seconds here, and that we add it all together and say, it's magically 15 minutes. There is some room for, judgment in there, because that is a professional judgment in itself, that 15 minutes.
We repeated that with them multiple
Yeah.
times, and we said, hey, we're gonna be reasonable about this. Like, are we reasonably in that ballpark or over? We're not counting to the second, we're not getting out a tape measure to say, hey, you were 3 feet 1 inch or 2 foot 11. It's gonna be some reasonable component that gets factored into it, so they were very supportive of
Yeah.
that, so.
And just like 6 foot became 3 foot, that was a professional judgment. That wasn't a scientific study decision. So there is some room for judgment for us.
But you would think they took all that into consideration when coming up with the 15 minutes regardless.
Right.
Can you speak up, please?
They can't hear. Can you?
Does your mic
Your-
on?
is your mic
Is your
on?
mic on?
Like talking straight into it.
Is it working now?
Can you hear me okay? Can you hear me now?
Testing.
All right.
Has, have you spoke to anybody from the city? Dr. Tomlinson?
No, I haven't been contacted by anyone at the city, no. I don't think they have anything in place I don't think the city or the county have anything in place for mask mandates.
Maybe not.
I think that's what Trey was referring to, is if it's just us who do it, then it won't have any real impact on community spread overall. It's gonna have to be multiple entities.
I agree.
All right, any further questions or comments? All right. Lisa, I'm gonna do a roll call vote.
No, we need a second.
Do what, Steve? I'm sorry.
She's already seconded.
Yeah, we already have a second. We're good. All right, we're gonna do this a little different. Instead of just showing hands, we're gonna do roll call. Darren,
Yes.
Stephen,
Yes.
Kenny,
Yes.
Rick,
yes.
Kaylin,
Yes.
and myself, yes. That passes 6-0. All right, having no other items on the agenda, I'd entertain a motion to adjourn.
So moved.
First by Kaylin,
Second.
second by Kenny. All those in favor? And that passes 6-0. Thank you all for coming out. Have a good evening.